We are more than 8 months into the pandemic in Saskatchewan, and while we know more than we did several months ago, there are still a lot of questions about COVID-19. And in an age of misinformation, it can cause some unnecessary gray areas. For more on this, I'm joined by Dr. Hassan Masri. He's an internal medicine and ICU specialist and an associate professor of medicine at the U of S in Saskatoon. Thanks for being here.
Thank you for having me, Sam.
Do you feel a responsibility to debunk information?
I do. I do feel that there is a personal responsibility on us as physicians, and especially on someone who now has a bit of a social media platform to certainly debunk myths, misinformation, and pseudoscience, because we are in an era where people obtain a lot of their information not from the traditional way that they used to obtain their information. I mean, I can't even remember the last time I held a newspaper, and I usually only hold a newspaper when I'm traveling in an airplane. And it even feels very weird to hold a newspaper. And so people get their information from Instagram and Twitter and Facebook, and sometimes from people they trust. And so if they see so-and-so spreading such information, because they trust them on a personal level, they may elect to trust the misinformation they're spreading. And that's where I feel that there is a personal responsibility as a physician, but also personal responsibility as someone with a platform specifically on Facebook.
What are some of the common myths about the coronavirus that you're seeing the most right now?
I think some of the most common myths that we hear about is that, and it's really unfortunate, is that when you test for COVID, that the COVID testing cannot differentiate between COVID and other respiratory illnesses. And in fact, most people, when they log into their online account to look the result of the test, and in the hospital, we know that the testing is specifically for COVID-19. And when we test for these viruses, we know that if you're positive for COVID, you will be negative for all the rest of them. And if you're positive for adenovirus or a different virus, you would be positive for it and not necessarily positive for the coronavirus. And the problem with such misinformation is that it automatically puts distrust in the system, distrust in the organizations, distrust in the hospitals and physicians, and it makes what they say less believable. But it also makes it sound like it is not a big deal and that it's just another flu or another virus. And it makes you not take things seriously. It makes you doubt whether you need to distance or limit your bubble. And so beyond just the immediate problem with such misinformation, there's consequences and ripple effect that goes downstream in terms of you not trusting the hospital, in terms of you not trusting the physician, in terms of you not taking things seriously, and it's just a brutal ripple effect that we obviously are suffering from.
Have you dealt with or heard of patients with COVID or their families denying that they've had COVID after testing positive?
I've not had such encounter yet, and I think part of it is, unfortunately, I'm sure it exists out there, and I've had colleagues who have dealt with such situations. But personally, as an ICU physician, because people who have COVID-19 in the ICU, I think that things are very serious and very real. And at that point, I can't imagine anyone thinking that this is just the flu. And so I have not had that experience, but I'm certain that it exists. I think most people who I meet believe that this is something very serious, this is something that's really real, and their families, by the same token, feel the same way. I do receive messages from families who left the hospital or families who their loved ones are in the hospital, because people find me easily now on social media, who state that they're very lucky. They feel very lucky that their loved ones have left the hospital and have done well. And I think that unfortunately sometimes people learn that way. But I do believe, by the way, it's really important to note that the bulk and the majority of the citizens in Saskatchewan are people who believe in science and believe in their officials and believe in their healthcare workers, and that sometimes that minority could be a lot louder than the number that it represents. But the problem when it comes to COVID-19, that without the collective effort, it is really hard to get this under control. And so even though it's a minority, it can be a very damaging one because it does not allow us to have a really good control on the disease.
What do you say to the anti-masker crowd that continues to protest in person and also the ones that spread false information online?
I have to say that I see the best in people, and even the people who are anti-maskers or anti-mask. I genuinely believe that they are good, decent human beings, and that they're my neighbors and my fellow citizens in the city. And I like to think that they are really, really good people. And what I say to them is, first of all, this is not a battle between me and you. You are my fellow citizen, you are my friend, you are my neighbor. But this is a battle between COVID-19 and you and I. And, you really, here in whatever we do, whether as a mechanic or a physician or whatever it is, we have to trust the professionals. And when I go to, for example, my mechanic, I don't. I go to someone that I trust, and then I trust their opinion. I don't, debate their opinion and say, well, I've read this and I've read that. As long as I trust that person, and so I think it's really important to establish respect and rapport with those individuals and try to educate them. I've had dialogue with many of them, and sometimes. That dialogue, the respectful dialogue, yields to people saying, well, I still have some doubts, but you know what? It seems like to be on the safe side, I should go on your side. And that's great. But the other thing that is extremely unfortunate is that down south of our border, COVID-19 and masks for a very long time turned to a political issue. And my very first post on Facebook when COVID-19 started, my very, very first post is I said, I trust my government, I trust my SHA, I trust my physicians, I trust the system and the institutions that have made us have this great province and this great country. And so, unfortunately, the making this a political statement was very damaging to our effort against COVID-19. It doesn't matter if you're NDP or liberal or conservative or right or left or moderate, libertarian. It doesn't matter. This is not, COVID-19 does not care about your political affiliation. And genuinely speaking, I don't care about anyone's political affiliation. This is a disease. I treat it like I treat diabetes. We don't treat diabetes differently if you're on the right or on the left. We don't treat hypertension and heart disease if you're conservative or liberal or NDP. We treat it the same. This is what physicians do. This is what the healthcare system is designed to do. And so I think one of the issues that I really try first of all, the dialogue has to be respectful. We have to respect them. They have to respect us. And it's not one way. We can't, call them names. We cannot disrespect them. We cannot use anything less than respectful to them. We really genuinely have to elevate the conversation to a respectful level. But then we have to really explain to them, this is not a political statement. This is just something that we really need to do because I really want to protect them. I genuinely care about them and their families and their loved ones, and I want them to be just as safe as my own family.
On a personal note, what is it like to treat a patient, you're an ICU doctor, who is not able to see their family through such a serious illness?
Today when I was driving, I was reflecting on that particular question and not knowing, to be honest, that I was going to be asked that question. And I have to say, out of all the things that we do, I think this is the one that I've not got used to. I'm not used to it yet. And I don't ever want to get used to it. In fact, I think it'll be a very bad sign if I'm used to that feeling. It's a terrible feeling to see someone, when people are sick, they really rely on their families and loved ones for support. And, prior to COVID, we know that when people get sick and their loved ones come, you see life back into their eyes. You see fight back into their bodies. And, it's really hard to see someone sick and someone having a hard time breathing or on life support and not being able to have their wife hold their hand, not being able to see their daughter and son hold their hand, not being able to even offer condolences or break bad news in person seems very cruel to me. And this is something that unfortunately we're forced to do. Certainly nobody likes to do that, but it is certainly the hardest part. And in fact, honestly, most of the time, that's what I try to continue to see the positive in people. But, if I ever get frustrated with anyone who doesn't take this seriously, it's because of that. It's because I recognize that you not taking this seriously puts me in a position where I have to go and talk to this individual in the room who's alone for many, many, many days. And people have to be behind the window seeing their loved one. It is something we are very much used to and trained to see very difficult things, but this is not something I just don't like it. It is very frustrating, and I hope that people do their best to make our job easier and make these hospital rooms less lonely for their loved ones.
How much has the recent real increase in cases affected the mental health of you and the frontline staff? How do you take care of each other?
I think it's tough, and I think that many times people think of, do we have enough nurses, and do we have enough doctors, and do we have enough respiratory therapists, and do we have enough physiotherapists and pharmacists, and think of the physical work, But I think at the end of the day, healthcare workers are human beings. I mean, when we leave the hospital, we have the same worry. We worry about traffic. We worry about our kids. We worry about will the grocery store have this and that we want. We worry about the same thing. We're no different than you and I and everyone else. And so I think that certainly these things take their toll on us. But we are probably trained for these moments, and it does affect us. And we all have different methods to cope with this. But it's hard because I know personally, and I know many people in healthcare are avoiding seeing their families because I consider myself someone who's high risk because I'm around COVID patients all the time. And so, we avoid seeing our friends and families, and therefore we lose a lot of our support system. But I think we're doing okay, and I think we have each other. And a few days ago, I saw a message posted by one of my colleagues, one of the nurses, and she spoke to me, and I thought it was amazing. She said, if anybody needs a virtual hug, a good cry, we're family. And even though we're unable to see our own extended families, but we are one giant big family, and we rely on each other for a lot of that support.
Thanks so much for your time and for your work.
Thank you.